think it's important to start with the American Academy of Pain Medicine and of Family Physicians recommends acupressure as treatment for pain, as a primary treatment for pain. And acupressure research in general, there's actually probably more of it than people think, but most of it is done in the hospital setting for usually peri-surgical things like anxiety or post-surgical pain or insomnia, things like that. So the body of literature for use of acupressure in the clinic setting is not as great. And so I thought, well, it would be wonderful if I could add just a little bit to that. And we all know that pain medication, anxiety medications tend to cause side effects for people. It's also very hard to get treatment for pain these days, very difficult, at least in the United States, to even get in to see a counselor. So I use acupressure in the clinic to kind of bridge the gap between, for example, for anxiety, well, it's going to be 6 months before you can see a counselor. What would you like? Is there something that we can do between now and then? So that was my rationale for taking a look at this. I took a very convenient sample of patients known to me in my clinic who had pain and anxiety. Basically, we did a standardized protocol according to the school of acupressure under which I'm trained, which is called Soul Lightening. And Soul Lightening Acupressure is based on the Chinese meridians that you would use in acupuncture, but also uses the chakras like are used in energy medicine or Indian medicine, Ayurveda. So the two are kind of combined together. And I did a protocol, the same protocol on everyone, so that I wasn't assessing a specific symptom or anything like that. And I did before and after FACES scale for pain, which is pretty common. It's the Wong-Baker FACES scale. You're either really happy or you're hysterically crying or you're somewhere in between. And there's a similar scale for anxiety. And what I found in the folks who had pain is that there was virtually no pain at the end of the treatment session when there was pain at the beginning. Similarly, for anxiety, the only person who didn't have a change in anxiety was someone who had very mild anxiety to begin with. So I did the treatment in about a 45 to 60 minute office visit, depending on the patient. And basically, I was pretty sure that I would find what I found, in that it was an effective treatment in that one clinic visit for reducing pain and anxiety. So the thought is that a larger group with more sustained treatment, say weekly or every other week over a period of time, could use acupressure as an adjunctive form of treatment for pain and or anxiety.